Loma Linda University, we have conducted over the last 60 years major research into the Adventist population. Adventists are fairly conservative Christian people. They are characterized by health emphasis. Adventists usually don't smoke. They don't usually use alcohol. They're quite often open to consuming more water rather than soft drinks. They're more into exercise, and they're also very consistent in their church attendance. So they have a very good social network. So this group of people around the world is characterized by this homogeneous lifestyle, except people around the world in the Adventist church have different dietary patterns. Please note here, you can see that about 9 plus 31 plus 10, about 50% of the Adventist people around the world are basically vegetarians. The other 50% are meat-consuming people. They're consuming dairy, they're consuming white and red meat and fish and so on. So let's take a look at this interesting population. Remember, they don't smoke, they don't usually use alcohol, they have pretty consistent church attendance, they have good social networks, but they're different in their diets. Please note, about 9% of the Adventists are total vegetarians, they're vegans. About 31% of the Adventists are vegetarians, but they use some dairy and egg products. And 10% of the Adventists are vegetarians that use fish. So these are the vegetarians, and then you have about 50%, the rest are meat eaters. And the federal government came to Lebanon and said, we're very interested to see if different diets have a different impact on these modern killer diseases. And so they made millions and millions of dollars available. And the Adventist Health Study began, the number 2 health study began in 2002. They enrolled close to 100,000 Adventists in the United States and Canada. And they classified them all according to their dietary habits. They filled out long, long questionnaires, 50 pages full of questionnaires. They were very carefully followed with in terms of their hospitalizations, their diseases, and their deaths. And here's what they found. They found that when you look at the vegans on the left-hand side at the bottom there, when compared to the meat eaters, the red bar, you notice that the vegans over the next 7 years, 1.6% of these vegans developed diabetes. And when it came to the meat-eating Adventists, 6.3% developed diabetes. That means there's a differential of 6.3 versus 1.6. That's 400%. 4 times more of the Adventists in a 7-year period developed diabetes. Meat eating versus vegan, 4 times differential. And please note the stepwise progression. The further you go towards a pure vegetarian lifestyle, the less diabetes you have to worry about. The same thing is true for hypertension. Here, the differential, again, is 4 times. You have 19% of the Adventists develop, the meat eaters develop high blood pressure, while in the vegan group, only 5% develop high blood pressure problems, and everything else is in between. Cholesterol, similar. The meat-eating Adventists have 15% that develop high cholesterol numbers that are being treated with medication. On the other hand, on the left side, you have only 3% of the total vegetarians, the vegans, that develop high cholesterol that would be treated by medication. So again, this is a 5-fold differential just because of the diet differences. So the same thing is also true for weight. Adventist meat eaters on the average weigh about 30 pounds more than the Adventist vegans. And so we can say in summary that it is estimated today by experts that probably up to 80% of our chronic disease and premature deaths could be prevented by making significant changes in diet and lifestyle. And so what I want to talk to you about and focus on is the question, what would happen if we applied these preventive lifestyle related strategies? And we can prevent this.